Hi to all the members of the IBS support group. This is Desiree coming to you live from an office that I'm in. And I wanted to actually tell you a few things today. The reason why I came on is because I wanted to communicate a few things to you today. The first is I want to ask you why you guys are here. So I can tell you why. Internet is fun. Okay. I can tell you why Gabby and I first started this group. So we're both professional naturopaths. We have busy in-person clinic hours where we see patients with IBS, with digestive issues, and with other related issues such as stress. And some people come in for weight loss, and some people come in for different types of situations, all regarding their health issues, and we give private consultations. So we've decided to start this group and invest a lot of time and energy into this group because we want to help. We're here to help. So if anyone needs that personalized, customized help, please reach out to us. That's what we're here for. And I really, truly hope that you guys are in the group for fun. That's number one. But also really much more than fun. On a more serious note, I hope you guys are in the group to get help and finally dive into your situation, trying to uncover why the IBS might be there in the first place, not covering up symptoms and, managing, patching up symptoms with Band-Aid solutions and messy medications with lots of side effects. But on the flip side of that, to really try to understand what is going on underneath those symptoms of IBS, because those symptoms, the diarrhea, constipation, bloating, acid reflux, those are really just signs and symptoms that the body is giving us to tell us that something is actually going on underneath, okay, underlying the entire situation. So why, for example, do we have food intolerances and we can't tolerate the gluten, we can't tolerate the dairy, we can't tolerate going out for dinner? Happy Valentine's Day today, guys. I hope you're having a beautiful Valentine's Day. But why is all of this happening with our body? And then we end up going on all these restrictive diets and just taking out all of these foods from our diet. But is that really the solution? That's a temporary solution. Again, you want to get to the underlying cause and you want to fix your digestion. You want to heal what is going wrong in your digestive system. Okay, so I just want you to look at your health and your digestion from that point of view rather than managing superficial symptoms, trying to understand that root cause of suffering and what is happening underlying those symptoms and how can we fix that. So the other reason I wanted to come on today is because February and March are really exciting months for us. Gabby and I have decided to cover some really foundational, important topics when it comes to digestive system imbalances and irritable bowel syndrome, which is the reason why everyone is here. That being said, everyone comes from such a different point of view. People are at all different levels in their healing journeys and different manifestations of the disease. And therefore, an individualized approach must be implemented. But the topics that we're going to cover in February and March actually apply to everyone because they actually give you a different perspective, a different way to look at health and disease. So I'm just going to go through some of the topics really quickly. I'm going to post a little image that I actually created, a little graphic that's going to tell you what's coming up for the first 4 sessions. So our weekly show is called Shooting the Shit. I hope you guys like that name. We thought it was really cheeky and funny, and we wanted to have some fun with it. And I want to tell you that I hope you tune into these Facebook Lives. They're all happening right here in the IBS support group. They're absolutely free. They're going to be very educational. We're going to start from the foundation. So for example, on February 18th, we're going to be covering what is IBS, just going right to the bottom, right to the initial investigation of IBS. Some people maybe don't even know. Maybe it's your first run-in with IBS. Maybe you've just been freshly diagnosed. You have no idea what is happening in your body. So we're going to really cover the basics. What is IBS and what causes it? What are the main factors that come into causing IBS? On February 19th, we're going into the staggering statistics of IBS, how prevalent it is, how many people suffer worldwide. That's why our group is called the IBS Support Group Worldwide. It's the strongest and fastest growing one. It's the largest one. And how to deal with just being a number, okay? That is a lot of the time how most of the IBS sufferers that we speak to feel, just a number, especially when they go to see their medical practitioners and they don't really get answers. The next thing that we're going to cover on the 19th is the most effective ways to treat and remedy IBS. On the 20th, we are going to get into 2 indisputable laws for busting through your IBS symptoms, okay? These are very naturopathic ideas. They are very different than the conventional approach of looking at health and disease. We're going to give you a different way to look at your body, a different perspective, a different approach. And it's going to be very eye-opening. You're going to open your mind to the different possibilities that you might not have heard of. And that's going to be transformational and revolutionary for you, because you're going to see that, you know, if you feel stuck and hopeless and that you've been told it's all in your head and that you've been told that nothing's possible, we're going to show you that the opposite of that is true. And we're going to give you some concrete, effective tools that you can go away with at the end of the Facebook Live, so you can actually start implementing some promising effects and getting some promising results. On the 21st, we're going into guessing instead of testing. So many on this group are wondering about testing. They've gone the conventional medical route. They've had the conventional tests, you know, laboratory tests done with their medical doctors, with their medical practitioners, and the results come out as nothing's wrong. Everything is fine. Go home. You just have IBS. And then what are you supposed to do? And then you're stuck with this compilation of symptoms that you're dealing with every single day that are taking over your life, and you have no idea what you're supposed to do about it. So we're going to go through alternative testing, because I won't get into the details now. I'm so tempted to actually get into the content now. But we're going to go into the different types of testing that you can actually go with, and that's going to save you a lot of time. It's going to save you a lot of stress. It's going to save you a lot of headache. Guessing, you know, are you guessing instead of testing? And if you are, you might want to be testing instead of guessing. And if the conventional medical tests aren't serving you, aren't giving you the answers that you need, we're going to present you with a whole bunch of other functional medical tests that you can run. And it's so worth it. You know, your body is so worth it. Your health is so worth it. Some of them are a little bit pricey, but these are the tests that are going to give you the answers so that you can finally implement the exact program that you need in order to start healing your IBS, because you should not go one more day suffering with digestive issues. There's no reason that anybody in this group should be hunched over, sitting on the toilet for hours, waiting for a poop to come out with constipation, or running to the toilet 10 times a day with diarrhea, or suffering from excessive heartburn and a burnt esophagus and throwing up and vomiting and having a huge bloated belly. There's no reason for this, okay? And that's because IBS is not a disease. It's a collection of digestive symptoms, and digestive symptoms can be eradicated. So I want to give you that hope. I want to instill that hope in you guys, because we know this to be true because we help people in our clinical practices every single day just say goodbye to digestive symptoms. So it's possible for you too. If it's possible for them, it's possible for you. Okay, so how do we solve that puzzle? On the 22nd, we are going into the 2 non-negotiable laws for beating IBS. And we're going to go into the details then. And then on the 20th, so those are the ones I'm going to be posting up right now in my little infographic. But on the 25th, we have a whole bunch of topics lined up. And then going into the first week of March as well, we have a whole bunch of really, really, really fascinating, interesting topics. These are cutting edge ideas. These are not these old-fashioned ideas about health and wellness and how to take care of yourself, but these are really it's a cutting edge approach. Looking at how to view the body, how to view symptoms, what this could mean, and what the implications are on your entire systemic health, and how you can start implementing effective strategies. You know, science is just catching up with traditional Chinese medicine and Ayurvedic medicine, for example. Science is just catching up. Science is saying, hey, the foods that you're eating are having an effect on your digestion. Well, duh, of course, the foods that you're eating. Why aren't medical practitioners being taught about this? You are eating 3 to 6 times a day. Of course, what you're putting into your mouth is going to affect your digestive tract. Common sense. Modern medicine is just catching up. Modern scientific research on the microbiome and the importance of gut bacteria and how these bacteria are going to affect different aspects of your health and well-being, including your mental, emotional health. Okay, so your thoughts. And if you have depression or excessive worry or anxiety or anything like that. Science is just catching up. So we have to take advantage of this and jump on that bandwagon and see what the new cutting edge approach is to healing your IBS and getting rid of those digestive symptoms. So I really hope you guys tune in. We're going to be going live on Facebook almost every day this month, minus the weekends. And we're going to be educating about the different approaches that you can start implementing into your life right away to start seeing results and to start feeling better and to start getting out of IBS jail and to start really reclaiming your health and your life back, because that is absolutely what you deserve. So thanks for tuning in today. We love you guys. We love being in the group. Again, it's our, amazing place to be. We love posting in there. We love engaging with you. We love answering questions. So feel free to reach out to us at any time. We're here for you and we're here to support you. Okay, thanks guys. Have a beautiful Valentine's Day and celebrate love.